Hey everybody, happy Friday, and welcome to our podcast, Your Hometown Medical Minute. I'm your host, Hal Brock, and with me, as always, behind the scenes, manning the cameras, Mr. Ed Harrison. And I guess we should say welcome to March 1st, although it doesn't feel very springy. I gotta tell you, I am ready for the sunshine, ready for the warm temperatures, but man, it is cold, and it's going to be even colder tomorrow on Saturday, and then Sunday, precipitation coming through, so more snow, more ice, maybe Sunday through Tuesday. You never know. It's Oklahoma, but make sure you stay weather mindful because your immune system is actually at its worst, at its lowest in cold temperatures. So make sure if you're going outside to bundle up, put that jacket on because it's been a bad flu season. It's been a bad flu season. In fact, according to OK.gov, 1,346 people have been hospitalized this flu season, and they start keeping that data starting in September 1. So it really hasn't been that long. The flu season actually is expected to run through May, so keep an eye out, and again, stay warm. Our guest today actually is on the front lines of the flu. She manages our quick care department, which is an urgent care, meaning you don't need an appointment. You walk into Southern Plains Medical Center, located at 2222 West Iowa. You ask to see our quick care department. You'll be seen in minutes, and when you are, you'll be seen by my guest, Angela Thayer. Angela Thayer, she actually oversees quick care and now DOT certified, so actually oversees occupational medicine. She's a Norman Noble native, began her healthcare career working at the VA in Norman as a CNA. Then while she was doing that, she was actually working on her bachelor's in nursing, which she obtained from Oklahoma State University, OKC. Then she became a registered nurse and working at Integris while she was pursuing her master's degree. We got lucky enough to find her upon completion of her master's. She now manages a family practice here at Southern Plains as well, oversees our family quick care. So ladies and gentlemen, without further ado, Miss Angela Thayer. Angela Thayer, hey, thanks so much for coming here and taking time out of your day.
No problem.
Well, it's
a
really,
pleasure.
I know how busy you are, especially in quick care. Angela, like we just said, heads up our family quick care department. So, I mean, at any time, like we were just talking, you could get a rush of like 8 patients like right now, and then you're on the go, right?
Right.
Yeah, incredible. Well, hey, we just went over your background too, and you have such an amazing background in nursing. And so my first question is kind of what got you started into patient care, but then also a follow-up question, I want to know about your drive, because you were working at the VA while you obtained a bachelor's degree in nursing, and then while you were obtaining your master's degree in nursing, you were working for Integris. Mm-hmm. Man, that's a lot. What got you motivated?
I've always loved patient care. I like people and just seeing all the chronic disease and stuff in the hospital and things that's too late to fix. So I'm really driven to help people shape their lives in a way that they can prevent chronic diseases, and prevent the last stages of those through disease management. And, you know, some of them are reversible, like type 2 diabetes, that we can reverse with lifestyle changes. So trying to prevent some of that.
Isn't that crazy? And I don't think everybody knows that you can reverse things like that as long as they go and they seek the proper care. And so, you just mentioned, I mean, as a nurse, especially at Integra, such a busy place, you've probably seen it all. And so that kind of gave you the motivation to go in and help a little bit more than just being at there and actually providing and counseling people in good health.
Because most of the time when they're in the hospital, they're already in end stages of diseases, and it's sad because there's not as much that can be done.
Right.
If you have preventative wise, there's so much that can be done early on.
Well, we're so lucky to have you down here, and of course you are in the front lines because of the urgent care type setting. You are seeing them probably at their first sign of the symptoms because they probably have no idea, and they're just like, I need to go now, right? I know if I go to the doctor, man, that's the kind of pain I'm in. Like it's gonna be severe. All right, so we did get lucky because of your nursing background and wanting to bring that care down here. How'd we get you down here? Now, you're from Norman, so...
I'm from Norman, but I graduated from high school in a small town in rural America from Noble.
Oh, okay. Bears, right?
So I graduated from there, so I'm liking the small town atmosphere.
Yeah.
I just like rural health, and there's so much opportunity to educate people and prevent chronic disease in the early stages, and there's less access to care in these areas. But I like it because it's still hometown. You still have a family feel.
Yeah.
So in family practice, you can see, 5 generations. And just seeing those generations in family practice, you see trends that they don't even know themselves. You might know their family history better than some of them do.
That's so true.
And, I tell people genetics is the half that you can't control.
Right.
But your choices are the half that you can control.
Like diet, exercise,
lifestyle. Yeah.
Yeah.
So
she often harps on me because I'm known to walk down the halls with an energy drink. And so it's like every time, man, I get a warning from her. And one of these days, I need to start listening to you because I know it's a serious thing. I know. So you do so much, and we also mentioned you're now DOT certified.
Yes.
Congratulations. That's a process, right?
Yes, it's a process.
Going through the whole Department of Transportation. So you do so much on the family medicine side, occupational medicine side, yet you do it out of a different setting, a quick care setting.
Mm-hmm.
So tell me a little bit about the difference, because most people get time to look over charts, they know their patients. You don't have that luxury. What
Not
you get
always.
is what comes in the door, right?
Yes.
Tell me a little bit about that.
So I always rule out the most serious and then the most probable.
Okay.
I have family in the medical field, and so I learned that from my family members, but also from education. You learn out what's the worst case scenario, because you don't want that to be it.
Right.
Or if it is, you got to rule it out, and then what's the best case scenario or most likely.
Okay.
For occupational medicine, for the quick care environment. But then I still do have my own family practice patients.
Right.
And I do try to open their charts in advance and get all their lab work done in advance and arrange more time to speak with them on preventative measures.
For sure, which is definitely, it's so valuable, especially, and I'm going to go touch back on there, but diabetes. It's so prevalent in our area, not only just, we're in rural America, and so it's even more, and you mentioned the access, it's just getting worse in rural America. In fact, 5 facilities closed within the last couple of years, and another 60 are on the docket in the next 5 years, just in Oklahoma, 600 nationwide, and so that brings us to kind of a crazy flu season this year.
Yeah.
We just mentioned more than 1,300 people have gone to the hospital, not just to a clinic. So, I mean, it's gotten so bad, they've skipped urgent care.
Right.
They've gone into a hospital. So what have you kind of been seeing as far as the flu?
We've seen plenty of flu. We had a little tiny bit of it in December, and we're having a resurgence of it now as of starting last week. This week, we've had more flu cases. In the beginning, I saw more flu A. We're seeing flu A and B now.
Really? Mm-hmm. Now, what's... I don't know the difference. I mean, I'm not...
Symptoms are different for every person, but most of it's respiratory. But some people can still have GI symptoms, and that's more prevalent in B.
In B,
But some patients can have both, which is horrible. So
it doesn't sound like
you don't want respiratory and GI.
No, not at all. That's not a fun weekend, for sure. Okay, so... if people, we still have the flu shot, and so it still works, right? I mean, you don't have to get it.
It's the CDC's best guess.
Okay.
So, there's no guarantee.
Right.
But it doesn't hurt to get it because you don't know what strain you're going to get. And there's more than one strain out there.
Right. So I've heard of people, or it was on the news the other night, people are asking their provider, should they get a second flu shot if they've already had one? Like they got one in September. And since the flu's so high, they were thinking about getting another one.
I think the CDC recommends if it's been longer than 6 months.
Okay.
Look on the CDC guidelines. But they're really strict on when you should get vaccinated.
When you should, yeah. In the flu season, a lot of people don't know it's long. So it runs through May.
6 months, yeah.
Yeah, so I mean, we've still got a couple more months left of this thing. And
so if you got yours in October, you might consider getting on the website and checking. And
doing that again. Okay. Well, so I know you're busy, and it's still in the middle of the day, so I know you got to get back and see patients, but really pumped up about your DOT certification. I know it's a big thing, because I know it's a long, grueling study process, and you got to take a test, but that's really cool, and what a great service you provide to the community because of the manufacturing plants we have here, ag, oil and gas. DOT is really important. Can you kind of explain some of the services you can provide now that you're certified, and some of the things you do for employers through occupational medicine?
Sure, we do urine drug testing, we do alcohol, breath testing. We also do the full physicals where we do hearing, vision screening, and full health screening, so they can be certified.
For DOT,
Department of Transportation, yes. And, there's different levels of certification based on their health. So some patients, if they have, cardiovascular disease, for example, if it's not well managed, we can still certify them for 3 months to a year, depending on their level of health. And most healthy people are licensed for 2 years.
Okay. So just because they have some complications, I mean, as long as, and that's what I think we've been touching on a little bit, as long as people actually go
if it's
and
well
seek
managed.
care. Yes. We treat our health sometimes like we treat our cars. As long as it's getting us from point A to point B, we'll suffer through it, right, and get to it. But that's not good. Not when you're dealing with the number one most important thing you have, your health.
You only have one body, and it's like not changing the oil in your car. Eventually, it's going to break down.
Yeah, right? And you definitely, I don't want that. Well, Angela, thank you so much for joining us. We're so happy to have you.
Thank you.
You've been such a delight to have here. You get nothing but good phone calls from the care that you give, and, you're just as nice as can be. Thank you so much for your time.
Thank you so much.
Absolutely. Hey, thanks for watching, and join us next Friday as Lab Director Corey Couch joins us here on our podcast, Your Hometown Medical Minute. As well, next week, we're going to try to get some follow-ups with chiropractor Dr. Chris Ludwell, maybe some insights into a chiropractic appointment. We're also going to go over to Southern Plains Vision Associates and talk to manager Angie Smith, maybe check out one of their retail centers. But hey, thanks again for watching Your Hometown Medical Minute.